we're having this because NPR just this week came out with a great article that said millions of older women don't consume enough protein. And then I subtitled it that you're the solution because we could do something about this. So this is the article, just came out. And so when she was talking about this is Allison Aubrey, and I am a big NPR fan. And what she really showed was millions of women. When you actually look at the statistics, though, and she's saying who's not, she said that 30% of men 50 and older and half of women 50 or older do not get enough protein. And so then she said she upped hers to 90 grams. So let's take a look at why she would say that and what do we know from all these years that I've been doing this and working on this. The first thing is that what we do know is that a lot of women and men can complain of loss of muscle mass and muscle pain, which is due actually to their protein deficiency. When you look at these articles that have come out, even as early as 2016, the other impacts of these protein deficiencies, and like in this case, where her mother had fallen, you can get swelling, especially of your legs, because we know that the only way that you can get blood back to your heart is called the skeletal muscle pump. So you got to actually pump that blood back up to your heart. The second thing that we also know is that your skin will always give up whatever nutrition that everybody else needs. And so your skin is really like a reservoir for a lot of things. So rather than actually have your heart be an issue, your skin's going to give it up. And so when women think, oh, I just need more biotin, that is not really the issue. We really need the B vitamins and we need the protein. There was a great study that said that if you were postmenopausal women, you could reduce your bone loss by 20 grams, by eating 20 grams of supplemental protein in a day, and your bone loss would go down by 2.3%. Because your immunoglobulins are needed to not get sick, you can actually get sick more often and you can get sicker. And unfortunately, when you do not have enough amino acids, your muscle is going to make you feel a lot hungrier. So it's likely that you're going to eat excess calories and then you're going to gain weight, but it's not going to be the right body composition. So I found that really, really interesting. So when I really was going to explain to put this up on our website, what I really think that people don't understand well, and when you're talking with patients or a patient is watching this, what I think is so important when we're looking at all these different things as I move this out of the way, the one thing that's super important for us to remind our patients is that the majority of protein is in fact digested in your stomach. The number one most common drug that is given are antacids. It's the most common prescribed and over-the-counter drug taken in the world. Now that's going to have a drug-induced nutrient depletion that maybe I could even be eating my protein, but I'm not going to digest it and absorb it. One of the reasons that people take antacids is that we know that we're getting reflux into the esophagus. But what's interesting is this, the pyloric sphincter for food to go out, that's a proton or hydrogen ion dependent sphincter. You actually have to have acid for your contents to go this way, to go down. If this stays closed because you're under too much physiological stress, then the only place when you're moving around for that food to go up is into your esophagus. So I think a lot of people who have gastroesophageal reflux disease, as many of us on this call know, is really due to too little stomach acid. So that's one thing that as we're talking about eating more protein, we actually have to say that. So one of the nice things that seems to fix that for a lot of patients is Number one, get off the antacid unless they absolutely have to be on it because they're on GERD. Number two, they could do some apple cider vinegar. That's going to open the pyloric sphincter and have things go down. And if they do have GERD, I recommend that they speak to their doctor and go on what's called an H2 histamine blocker. If you're on one of those, like famotidine, they all end in IDINE. What that's going to do is only depress stomach acid for 12 hours. Since you're really much more at risk when you're lying down, now say at 8 o'clock at night, or you finished dinner 8 o'clock at night, now you're going to take that, you're going to be good till in the morning. Whereas if you're on a 24-hour proton pump inhibitor, anything that ends in OLE, like a omeprazole, then you're never going to have stomach acid. Now you're going to have to take an enzyme. You're going to have to take a protease that works at a higher pH. And that's hard for a lot of people. So I think if they could work with their doctor, and it's also over the counter, talk to their pharmacist, do something overnight when they're lying down, but while they're upright, and then maybe in the morning, have a little apple cider vinegar before they have breakfast, open that pyloric sphincter, I think that they'll have the food go down. So that's going to be super helpful, as we're going to ask them to up their protein intake, because that's what really is important for a sign of health. To remind our patients that when you're learning, when you're thinking in your brain, and you have those axons, that is filled with microtubules, and they are made of protein. And when you're learning new things, that takes protein, and you're building that overnight. And so again, really important to have good sleep hygiene. When they have a picture of the kidneys, they're just saying if you had excess, that's how you're going to possibly have to get rid of it. But we also reabsorb our amino acids in our kidney if everything is working well. Now, intriguingly, again, that needs a little bit of sodium. And so we don't want to have a no sodium diet. So the people I notice that in an acupuncture way have a kind of kidney chi issue, that's because some of those women have husbands that are hypertensive, but then they're not eating enough salt. So that's an interesting thing. See if, talking to the women, are you having some salt in your diet? We know that in order to build skeletal muscle, we have to do weight-bearing exercise, and we have about 90 minutes to that, probably 30 to 90 minutes, maybe 2 hours post-workout that we really want to consume that protein with some, that amino acid, that protein with some carbohydrate. When we don't, then our liver is actually going to go to our skeletal muscle. We don't eat enough. We're going to actually use our skeletal muscle as our own steak. The liver is going to then raise it so that we have that protein that we need. And then this little thing about the adipose tissue, I thought it was interesting that this was talking about this in a fat and malnourished state. What I find really interesting is that to put amino acids in adipose tissue just does not occur. And so when you're not eating enough protein, it's much more likely then you're going to want to up eating more carbohydrates. So I'm not really sure. They're just kind of talking about that in this. For patients to really remind them how important when you do not eat enough protein, all of this muscle, your body thinks is steak. And so I say so often to my women patients who just don't want to eat any animal protein, I get that you don't want to have a steak, but you are being a cannibal. And I think if they understand, they might not be eating a cow, but they are eating themselves, it does at least have some impact, because a lot of women in that over 50 age group, they sort of came of age in the 80s, and both protein and fat got vilified. And so it's really hard emotionally to move some of those women into the newer literature. It's really hard to get some of those women to get the importance of doing weight-bearing exercise, that we cannot actually build muscle without weight-bearing, but we also have to eat the protein. And the other thing that's so important to remind our women patients and women in general is that those mitochondria that are going to burn that fat, they live the most are in your heart, followed by your nervous system in terms of the number per unit of tissue, but you just have so much more muscle mass that your metabolic rate is completely determined by your muscle mass. So now their overall health, their tissues, their organ function, their immune response, their skins and their nerves, none of that is going to have the integrity that it needs to have, because you're literally going to break that down. So I think really getting that point across to them is really going to be helpful, especially that this article just came out really talking about that's 1 out of every 2 women that we know over 50 does not have enough protein. That's pretty amazing to me. This is a really interesting paper that just came out. And as I was looking for this, this is that paper rather than the 2016 paper. So it's been out a while, but I think for those women to really understand this muscle loss, because they're not having enough skeletal muscle, they're going to have this super interesting problem with slower recovery from illness, slower wound healing, reduced metabolic rate. They're going to have a poor quality of life, and ultimately that's going to lead to higher healthcare. Now, this paper, why I picked this paper, was when we are looking at something like a medical journal, and they are saying in the medical journal that you're going to have to exercise and do nutrition, and that you must do dietary protein, and the protein needs to just have leucine in it. Leucine is a branched chain amino acid that is been shown at about 2.5 grams in a day. It doesn't allow you to break your own muscle tissue down, and the reason is it intriguingly cannot become glucose. And so when you don't eat enough calories, it's always your muscle that's your reserve. But if you have more protein and has branched chain amino acids, so what proteins have branched chain amino acids? Branched chain amino acids are the main component of all protein, plant and animal, because it is the structure. So anything that has protein is going to have branched chain. So do you need extra branched chain amino acids as a supplement? I do not. The literature does not show that. Why is it that we're having an issue? Well, the RDA is 0.8 grams per kilogram of ideal body weight. But here, the literature is saying most people aren't getting that 50% of women aren't even getting the RDA. And that's because when you look at a lot of things that people are doing these days, they're really driven to carbs, because under stress and you don't have enough stomach acid, carbohydrates are not digested in your stomach. So what happens is they're going to be kind of leaning towards the things that they can digest. The bread, the tortillas, oatmeals, the cereals, all the fruits and vegetables, they're just much more likely to go into that. And I like this thing that was really interesting, where when you start to read everything, it says, without actually saying that you're going to be committed, that your number one thing you're going to figure out that you're going to build your meal around is protein, it's really hard to have a sort of conscious eating, because it's just so much easier to grab something quick and then skip it unless you really are committed to it. So I thought it was really interesting that she picked that 1.7 number. Really, the majority of the research is saying about 1 to 1.6 grams per kilogram of ideal body weight. But there are some papers that if you are an elite athlete, if you're working out all the time, you might need as much as 2 grams per kilogram. And then the most important thing here, when we say body weight, we're really talking about ideal body weight. So if you know, this is where people can get in trouble. They're trying to say, maybe my ideal body weight is 130 pounds, but I weigh 150. They really only need enough protein for 130. If we can get that amount of protein in, I think they're going to be more satiated. And what they're going to notice is they'll probably then start to shed that extra fat, because they're actually getting the nutrition that they need. And we really want to have 20 to 30 grams per meal. Now, I think anecdotally, we're seeing that the men, a bigger guy, is probably doing fine at 40 grams in a meal. But for the majority of women, that 20 to 30 is in fact the sweet spot. And that seems to be something that's really achievable. I chose for this slide so that you had this for yourself and for your patients and for the people that you know. What does 1.2 gram per kilogram of body weight actually look like? What I found intriguing when I went and looked at the literature is that the average male weighs 198 pounds, which is 108 grams a day. What I found astonishing is in the US, the average woman weighs 171. I found that quite surprising. So in my practice, I guess I don't see that exactly. I would say that normally in my practice, I'm kind of been doing more in this range for most of the guys, 90 to 115 grams. I guess I have a lot of men in the practice that are in that like 170-ish to 200 pounds. I don't have a lot of bigger guys in my practice. Maybe I just don't attract them, or basically most of the men that I see are married to the women that come in. So maybe that's the reason, and they're eating pretty well. But then what I just said is, like, since we're going to have to do 30 at a time, they maybe could do more. Then maybe really what would be best is 3 30-gram meals. And for the 115, they could do 3 30-gram meals and a 25-gram snack. That seems to really be working for them. And that seems to be what's helpful. I would say for myself, I tend to be, even though I am quite a bit less than that, I find for my muscle mass, I just do way better in that 80 to 90 gram range. That just always works for me. And so that's why I'm saying, like, for the majority of women, even the women who are weighing a lot less, I find to keep that amount of muscle mass up, for me to really be able to comfortably do a workout, I just do way better. I almost never go below 80, 85 grams in a day. I don't think I've done that in a really long time. I'm really pretty meticulous about counting. The good and bad is, I think you have to be honest with yourself and actually count. And so I do try to recommend that people do really start to learn how to count their protein grams, that it does seem to help when you have those, when you're actually really paying attention. That seems to matter. And I'm not a big snacker, so I just do the 3 meals, but you certainly could. And I think that's totally up to the patient. I wouldn't break it into less, but definitely try to figure that out. I think the hard part is when people are like, well, what is 20 to 30 grams? Because I think that some people have not been counting protein grams. They don't really get how hard it is to do. And they're like, well, I had my egg for breakfast. So what we did was we put this together. What we said was, what does breakfast, which is the most problematic meal of the day for the majority of patients to get enough protein, what does it actually look like? Well, if you buy just a small yogurt that's a plain yogurt that doesn't have fruit in it, it may be just 11 to 15 grams. And some people do those little snack bars, but they're very likely to be only in the 10-gram range. I think the hard part about oatmeal, which sounds so great, is it doesn't actually have that much grams of protein. You'd have to eat 2 full cups of cooked oatmeal to get 10. Maybe you could get a little higher protein. Maybe you're doing the Kodiak one that's a little bit more. But again, it's going to be tough if that's all you're having is oatmeal. Even a high protein cereal tends not to have more than 7 or 8 grams in it. I have the people who are like all about their bagel and cream cheese. Definitely not. That's going to fall way short. And eggs are only 6 per egg. And say they're like, well, I did my whole wheat toast. I did my my almond butter, my peanut butter. Also not going to make it, fall way short. That's only 7. And the problem with whole wheat toast is the majority of whole wheat toast is only about 5. So at 5 for the whole wheat toast, some of those toasts they've changed. Wegmans has changed their formula for their whole wheat toast. They used to have 5 grams of protein in it. They went to 4. I found that really surprising because I was kind of counting on that 5 from that, but now it's only 4. that's only 12 grams. And if people actually go out and buy a breakfast sandwich, it's just not going to make it. And so there is another paper that came out that I was looking at in terms of muscle health and bone health. And what they showed, because it was saying women over 50, now they're likely perimenopausal, but there's this great new paper, this paper that just came out this year that had two really interesting things that I wanted to add to this. And that is that osteopenia was not just lack of calcium like a lot of women think. It was actually dietaries low in vitamin B12, pantothenic acid, phosphorus, riboflavin, animal protein, total protein, B6, potassium, vitamin D, vitamin E, calcium way down on the list, some cholesterol, and we'll talk about that in a second, beta carotene, omega-3 fatty acids, magnesium, zinc, niacin, and selenium. One of the things that I say often to my women when they come back and they don't have a good score and they are working out, so they're theoretically trying to increase their bone health, but what they're doing is they're focusing on this calcium. But what I try to explain to them is that calcium is like the wood. And what you need is an osteoblast, the builder. And if I have a lot of calcium, but I don't have the builders, then I just basically am 84 lumber. And that's why my bone health doesn't look well. And I think that's been really helpful to the women to really hear that reasoning. And I'm like, the osteoblast really needs that magnesium, the zinc, the selenium, the niacin, the riboflavin, the protein, the B6, the phosphorus. That's what the builder needs. It's just going to build with, and the calcium's the wood. That really has helped. And getting women on board that they need all these other things to support their osteoblast. And when they start to see that they have less muscle pain, that their bone mineral density has started to stabilize, that has been really helpful, because I see a lot of women in their 60s and 70s, because I'm 69. So I just have, these patients have been with me for 30, 40 years. The other thing that's interesting is if they don't have enough iron because of the mitochondria. This, I think with the iron, I do see that, especially in that group of women over 50, they do lean away from red meat for whatever reason. But they have to understand, even if they're not menstruating, they still need the RDA of iron, which is 7 to 8 grams. And if they don't have it in their with their protein, it's one of the reasons we did chocolate to begin with, because the cocoa has a bit of iron in it. So kind of partly why I did it. But vegetable protein can be incredibly helpful. And then here's the B1, the folate, so important for metabolic rate, for getting rid of homocysteine, for DNA synthesis, all of that. But fiber, both total fiber and insoluble fiber, having vitamin A, K, this is the E again, and copper. But here's the other thing, really getting women in particular to neither vilify the red meat or the salt. We can't really get our amino acids or even our good quality carbohydrates. They have a sodium dependent symporter, both in the intestines and the kidney. And so we just can't have a no sodium diet. I didn't put it on this slide, but in 2022, last year, the paper came out really showing it was really the sodium potassium balance, just like we've known it's the calcium magnesium balance, the yin and the yang. Sodium is an extracellular ion, while potassium is inside. But the latest literature is saying if you have a 1-to-1 or 1 to greater than 1 of sodium to potassium, and I started to keep track, sure enough, it made a huge difference for how I felt. You know how sometimes you get in your patients or yourselves, you can see the marks of your socks. I have found that when I'm consistent, where I have about a gram of sodium a day, the RDA for sodium is actually 2 grams a day. That's definitely not good for me. It's a little too much, because I would then have to have over 2 grams of potassium, which I don't seem capable of doing because I keep track every day. And I'm eating 5 cups of fruits and vegetables in a day. So if I'm having trouble getting 3,500, that's the RDA for potassium, 3,500 milligrams or 3.5 grams. In my good quality fruits and vegetables, maybe I'm at 1,800. And I'm literally every day, I'm having a sweet potato, I'm having a banana, I'm having spinach or kale or broccoli or something. If I'm having trouble, I can't imagine what other people are doing. So I drop my sodium to make sure that it's still in there, about 1,000 to 1,200 milligrams of the sodium. And then I literally keep track so that I try to have 1,500 milligrams of the potassium. That really seems to have really gotten rid of any swelling in my hands as I'm older. I can really close my fists up really nice and tight. I don't get that kind of swelled feeling. That's what's really going to help that balance. And again, same thing, having enough calcium, but then also having that extra magnesium in the evening. And what's interesting about that both vitamin A and the beta carotene matter, they do work slightly differently. So the beta carotene is really, really important for vision, sure, but also it's really important for your mucous membranes. There's a small percentage of people who are not good converters of beta carotene into vitamin A. And vitamin A and the tocopherols, if you are deficient in them together, then you're at risk for senile cataracts. So I think that's why it was really important to me to have some vitamin A. Now, vitamin A at 2 times the RDA, at 200%, then you're at risk for bone demineralization. So like some is good, but too much is definitely not good for your bone health. So very important for patients to really look at, especially if they're drinking fluid milk and other things that vitamin A palmitate is added to, that they don't go over that 200% of the RDA. That's when they're going to start to possibly demineralize. And yogurt and cheese does not have vitamin A palmitate added to it, only fluid milk. Used to be more. It's down. I went and looked at all the labels the other day because I knew I was going to do this. And it looks like it's only 10% of the RDA now in 8 ounces. And it used to be quite a bit more. But if you're some massive milk drinker, then you might want to be concerned about that, and why maybe fluid milk may not be the best choice if you're looking at that. So one of the things when you ask somebody, well, do you even eat protein at every meal? Like when we're saying, why is 50% of the women, what questions could we ask them? And even know whether we should be having them watch this presentation or talking to them, are they in the 1 out of 2? First off, do they even eat protein at every meal? Some don't. They just either skip a meal, or they're like, well, I had salad, and they're really not having it. I have to ask people how much you think you eat. Do you know how much you eat? Everybody who knows how much they need, they are counting it. I could ask Rhonda that, right? Rhonda, on your athletes, they know how much they're eating, right? Rhonda's there.
Yes, I'm here. Sorry, I had to unmute myself. Yes, I am a big proponent of counting macros, and especially protein. Protein is an absolute for all my clients. So they know what they're getting, they know what they need, and we get to that number.
Yeah, and I think it's one of those things. In the beginning, you just really got to get them to do it. When they do it, then they really know what they're doing, because it is really shocking, people that don't actually know. Or do they get muscle pain? Susan, you're on. What would you say when you're asking your patients? Like, do you think they're actually counting, or what are you seeing with your practice?
I am seeing that most people are not getting enough protein. and they say, oh, I'll have an egg and I'll have a little toast or I'll have some nuts. And I'm like, okay, let's talk about protein. But most of them are really under eating protein.
Yes, and I think when she came out with that NPR article, and we're talking to people, and they're coming to us because they have muscle pain or they're experiencing that. And the really nice thing when we're talking about women over 50, the thing that Atul Gawande in his book Being Mortal said is it's critically important that you can stand on one foot, because this is how you're going to fall, because you have that swing phase. And now you cannot stand on one leg long enough to swing your foot. So I have them literally like hang on to a chair to begin with. If they feel like they're going to be unstable, can they stand on one leg? And then can they pick that other foot up and swing it from back to front like they're going to take a prolonged step? And they got to start practicing that. And then I really find is very related to their protein intake and to their overall fitness. So we can just ask these easy questions to know whether or not we actually have the solution for them on what they could do. And because breakfast is the most skipped meal of the day, and we're going to have to do 3 meals of 30 or 3 meals of 25, it's really why in the end I did this, because we called it breakfast because that was what people were really missing. Now, I like it for lunch these days. It really has worked out for me. I'm incredibly busy at school right now as I'm getting ready to not be there. And I just don't have time for lunch. So I'm doing a better job getting up early, and I can have dinner for breakfast. And then I can have a shake for lunch. But this has really been so easy. And when we talk about this in terms of, for the patients and the ease of it and how much nutrition they're going to have for with the vitamins, and it just really worked out for me. So I think in summary, what we can say to all of these patients is we want to have this protein, but in order to also support your mitochondria, which are living there, having these extra vitamins and minerals are going to be a better support than that. Now, what is interesting to me is if somebody's going to do a post-workout drink, so they say they're going to have the shake for breakfast or lunch, and they want to do another one, then I let them have whatever kind of protein shake they want. They're like, oh, I want to do the meat protein, or I want to do whey protein, or I want to do whatever protein. I'm totally good with that. If you want to add, especially for the big guys who have to do 3 30-gram meals, and then they want to do a post-workout drink, there's no need that they have to have extra vitamins and minerals. The literature on adding a whole lot of more vitamins and minerals, it's just not great. Unless they really are on a lot of medicine, I don't really see the need for that.